HVAD system helps your weakened heart pump blood throughout your body, allowing you to return to a fuller life. The HVAD pump's small size and integrated inflow cannula allow the device to be implanted completely in your chest, in a sac around your heart known as the pericardial space, thereby avoiding abdominal surgery. The driveline cable, constructed with fatigue-resistant conductor wires similar to those used in pacemakers, exits the skin and connects the pump to an externally worn controller. The HVAD controller operates your pump and monitors that it is working correctly. The display on the controller provides you with information about pump performance that includes the blood flow, the speed, and the amount of power being used. The face of the controller has two buttons. The scroll button, which allows you to toggle through information on the controller, and the alarm mute button. There are 4 connectors on the controller: 1 driveline connector, 2 power supply connectors, and 1 data port, which is also used for the alarm adapter. The silver driveline connector should have the driveline cover in place. When properly positioned, the driveline connector will not be visible. The controller requires 2 power sources connected at all times for safety, either 2 batteries or 1 battery and either the AC adapter or DC adapter. While active, you will typically use 2 batteries. While relaxing or sleeping, you should use the AC adapter because it provides power from an electrical outlet for an unlimited period of time. The DC adapter draws power from the electrical outlet in an automobile and can be used when you are traveling by car. To connect any of these power supplies, grasp the power cable near its connector, leaving the front free to rotate. Line up the solid white arrow on the cable connector with the dot on the controller. Gently push the cable into the controller. Do not twist the connector, but allow it to naturally lock in place. A good connection will result in an audible click. Confirm that the power cable is properly locked to the controller by gently pulling on the cable near the connector. To disconnect a power supply, grasp the power cable on the front end of the connector. Turn the connector counterclockwise until it stops. Pull the connector straight out from the controller. If another power source is not connected within 20 seconds, the power disconnect message will be displayed on the controller display and an alarm will sound. Once a second power source is connected to the controller, the alarm will stop. Do not disconnect both power sources at the same time. This will result in the pump stopping. Only disconnect your driveline if instructed to do so by the controller during an alarm or by your clinician. Anytime your driveline is not connected to the controller, your pump is not running. To disconnect the driveline from the controller, first slide the driveline cover away from the controller so you can see the whole silver connector. Next, place your fingers on the silver connector over the ringed area. Finally, pull back on the ringed area to release the locking mechanism. Please note that if you pull back on any other area of the driveline or connector, it will not release the driveline from the controller. To once again connect the driveline to the controller, first line up the red dots on the silver driveline connector and on the silver controller driveline port. Next, push the driveline connector straight into the silver port. At this point, verify that the pump is running to ensure a proper connection. Finally, slide the driveline cover over the driveline connector. The 2 battery indicators located on the top of the controller are labeled 1 and 2. Either the 1 or 2 will be lit depending upon which port is providing primary power. If an AC or DC adapter is connected, this will be the primary power source. The battery indicators tell you approximately how much power remains in each battery. You can see how much power remains in the battery by pressing the test button, which will light up the battery capacity display. Your controller will instruct you when it is time to change your battery through 3 indicators. 1. Battery indicator will show 1 yellow light. 2. Alarm indicator will be solid yellow. And 3. The display will read low battery, replace battery. Make sure there is a fully charged battery available to replace the depleted battery. Disconnect the depleted battery, replace it with the fully charged battery, and confirm it is securely attached. When one battery is depleted to less than 25% capacity, the controller will automatically switch to the other battery. When both batteries are depleted to less than 25% capacity, both battery indicators will switch to one yellow light. An intermittent beep will sound. The alarm indicator will appear yellow, and a message will be displayed on the controller screen to replace battery 1. If the battery is not changed within 5 minutes, the alarm volume will escalate until the battery is exchanged with a fully charged battery. If a depleted battery is not exchanged, eventually, a high priority alarm will sound. The alarm indicator will be flashing red, and the message on the controller display will read critical battery. A charged battery or adapter, AC or DC, should be attached immediately to the power port with the critical battery indication. Never disconnect both power sources at one time. The battery charger is used to charge up to 4 batteries at a time. It must be plugged into an AC power outlet to charge batteries. A proper connection to the outlet will be indicated by the green light display next to the hardware logo on the charger. It takes about 5 to 6 hours to fully charge a battery. It is safe to leave the battery connected to the charger when not in use. The battery connects to the battery charger the same way it connects to the controller. Place the battery into the slot. For the best fit, loop the cable gently to the side and place the battery with the cable side down. Disconnecting a battery from the battery charger is the same as disconnecting it from the controller. Grasp the connector on the front end and rotate counterclockwise until it stops. Then pull the connector straight out from the battery charger. Each charging slot has 2 lights that tell you the status of the battery. A green light next to ready means the battery is fully charged. The light next to status may mean different things, depending upon the color. There are various alarms that tell you about the condition of the pump, controller, connections, and power supplies. Alarm conditions are classified as high, medium, or low. Each of these alarms has a unique sound, visual display, and message. A high priority alarm is displayed with a flashing red warning light and unique sound. A medium priority alarm is displayed with a flashing yellow warning light and unique sound. A low priority alarm is displayed with a solid yellow light and unique sound. The message on the controller screen consists of 2 lines of text. The first line tells you what the alarm is about, and the second line tells you what to do. The alarm sound will stop, and the alarm indicator light will go out when the alarm condition is resolved. A backup controller is included with your HVAD system. You should keep your backup controller with you at all times, in the unlikely event there is a problem with the controller you are attached to. The backup controller will also hold the red alarm adapter. This is for emergency use only and is used to silence the no power alarm when power is removed from a controller that is no longer in use. You should only perform a controller exchange when instructed to do so by your clinician, or if responding to a critical alarm that requires a controller exchange to resolve. When doing a controller exchange, the priority is to restart your pump quickly. It may be helpful to remember the 4 P's: power, pump, prevent, and power. The 4 P's summarize the steps to performing a controller exchange. If possible, have a caregiver nearby when performing a controller exchange. Follow these steps to change your controller. Sit or lie down and place the new controller within easy reach. Your backup controller will become your new controller. The first P is for power. Connect one power source to the new controller. The new controller may alarm after 10 seconds with a VAD stopped, connect driveline, high alarm. This is expected behavior. The second P is for pump. Pull back the white driveline cover on your driveline. Disconnect the driveline from the original controller and connect the driveline to the new controller. This should restart your pump. Verify that the pump is working. The RPM, liters per minute, and watts numbers should show on the controller display. If your pump does not restart, call for emergency medical assistance immediately. The third P is for prevent. Once you have verified that your pump is working, you can prevent the no power alarm from sounding on the original controller. If the alarm adapter is available, insert it into the data port, the connector with the dust cap, on the original controller. You can now remove all power from the original controller and no alarm should sound. If a red alarm adapter is not available, you can silence the no power alarm on the original controller by pressing and holding the alarm mute and scroll buttons at the same time for at least 5 seconds. Release both buttons. You can now remove all power from the original controller and no alarm should sound. The fourth P is again for power. Connect a second power source to the new controller. If you removed power before silencing the no power alarm, reconnect a power source and follow the steps just reviewed to prevent the alarm. Finally, on your new controller, slide the white driveline cover over the silver connector. Be sure the data port is covered by the dust cap. If the red alarm adapter is connected to the controller that is running your pump, remove it and close the cap on the data port. If you perform a controller exchange, be sure to contact your clinician to get a new backup controller. People who receive a VAD may notice an improvement in symptoms beginning in the hospital and should continue to get stronger in the weeks following surgery. However, adjusting to living with a VAD may take time. It is very important to protect the skin around your driveline exit site to prevent infection. Before you leave the hospital, your clinical team will explain and demonstrate proper care of the exit site. One of the most important measures you can take to prevent exit site infections is to protect the driveline from excessive movement. Take care not to pull on the driveline or get it caught on objects where it might get pulled or yanked. The dressing around your exit site should be changed according to your clinical team's instructions. Remember to always thoroughly wash your hands with soap and water prior to any dressing change. If your clinical team decides that it is safe for you to shower, you must use the Heartwear shower bag to protect the controller and batteries. Your clinician will help you obtain a shower bag and will review the detailed instructions on proper use of the shower bag. The exit site should also be kept as dry as possible in order to help avoid infections. You should document your pump parameters, blood pressure, and medications on a regular basis. Talk with your clinician about your medications. Get an explanation of the purpose of each one that is prescribed. Write down the medication and how often you need to take it, and ask your clinician to check the list to make sure it is correct. Make sure you discuss what you should do if you accidentally forget to take a medication, and understand that this might be different for each prescription. You may also want to make a list of medications that you should not take. Some non-prescription medications and natural supplements may react with what has been prescribed for you. You will be taking anticoagulants to thin your blood and reduce the risk of clot formation in your blood or pump. It is very important that you take this medication as prescribed and that you have your blood checked frequently to be sure that you are receiving a dose that is not too high, causing your blood to be too thin, or too low, causing your blood to be too thick. Call your clinician immediately if you notice a sudden change in how your pump works, feels, or sounds, even if there is no alarm. If there is an emergency, such as an urgent or life-threatening problem, call your local emergency medical services and then your clinician. You may be offered different styles of patient packs for carrying your controller and 2 batteries. Depending on your lifestyle, you may choose a shoulder pack or a waist pack. It is recommended that you use a Heartwear pack to carry your equipment. Your clinician will show you how to organize and wear your pack. Your cell phone should not be carried in this pack along with your VAD equipment. Electrostatic discharge, ESD, is the sudden transfer of electricity from one object to another. It is most noticeable in dry environments and near certain materials such as silk and carpeting. A mild shock to your skin will not affect your controller. However, ESD to the controller or its connectors may cause your controller to function improperly. ESD damage to the controller can cause a controller failed alarm, a high-priority audio alarm with a blank screen, or a controller fault alarm. To reduce the chance of ESD damage to your controller, make good connections when changing power sources, and be careful near objects that are prone to static electricity, such as televisions, dryers, silk, and carpeting. Your HVAD system is made of durable materials, but requires weekly inspection and cleaning. Once a week, inspect your batteries and battery charger, the power connectors, and connector pins on the controller. You should inspect for damage, dirt, or grime. This inspection is best done when you are changing power sources. Check only one controller power connector at a time. Use a clean, soft cloth, moistened with mild soap and water, to gently clean the controller and battery charger. The cloth should be moist, not wet, and you should avoid hard rubbing. Do not use soap to clean the exterior surfaces of the batteries. Just use a clean, moist cloth instead. While inspecting and cleaning, do not disconnect both power sources at the same time. Your pump will stop. Do not disconnect the driveline to examine its connector. The only time the driveline connector should be inspected is during a controller exchange. Do not attempt to clean the controller connectors. If any dirt is found, report the condition to your VAD coordinator. If any equipment appears damaged, contact your VAD coordinator for a replacement. Your HVAD system is designed to help you resume an active lifestyle. However, each person is different, and your clinical team can give you the best advice. Anytime you have questions or concerns, talk to your clinician. And don't forget to refer to your patient manual should you have questions about any of these procedures. By following these simple steps, your HVAD system may allow you the freedom to resume your normal daily activities.